Hi, I'm Molly Mulford, and we have a 25-year-old Caucasian female presenting in the clinic today for dizziness. Hi, Nikki. How are you doing today?
I'm okay.
So I hear that you've come in for dizziness. Can you tell me when this started?
Oh, the dizziness started about 3 days ago, I'd say.
How long does your dizziness last for?
About a minute.
Is it constant or does it come and go?
It comes and goes when I move. It's definitely worse when I move around.
Can you describe the feeling? Does it feel like you might faint, or does it feel like the room is spinning?
I get dizzy, sometimes I'm nauseous, the room spins around, especially when I'm moving.
Does anything make these symptoms better or worse?
When I sit still for a minute, they start to go away. And when I start moving around, like yesterday morning, I got up out of bed and it was really bad. And I got up laying off the couch after watching TV and it hit me real quick too.
Okay. Can you rate the severity of these symptoms on a scale 1 to 10?
I'd say about an 8.
Have you been around anyone lately that is sick?
No, I'm getting over a cold. My ears are still a little full, but it hasn't really bothered me.
Have you had any head or ear trauma?
No.
Do you have any family members who have experienced similar symptoms?
No.
No? Okay, I'm going to ask you a little bit about your history. Do you take any medications?
No meds.
Okay, so we can rule out polypharmacy as a cause. Do you have any allergies?
No.
Have you had any surgeries?
No surgeries.
Do you smoke or drink alcohol?
Have a glass of wine maybe once or twice a week, but I don't smoke.
Okay, have you had any family members that have a history of stroke, Meniere's disease, vertigo, seizures?
No.
No. Okay, so I know that you said that you were having a little bit of ear fullness. Have you had any ear ringing?
No, no ringing.
Have you had a cough or shortness of breath?
No.
Have you had any changes in your hearing or vision or speech?
Not really.
Have you had any chest pain or palpitations?
No.
I know that you said you've had some nausea with these episodes. What about vomiting or diarrhea?
No.
What about any numbness in your face or extremities?
No.
Any changes in your gait?
No.
Have you fallen recently?
No.
Okay, so I'm going to go ahead and get started with my assessment. From the vitals that your nurse did earlier, your temperature was 98.7, your rest rate was 16, your oxygen was 98 on room air, your heart rate was 80, and we did some orthostatic blood pressures on you. When you were laying down, it was 120 over 80. When you sat up, it was 119 over 78, and when you stood up, it was 120 over 81. So it doesn't sound like you're orthostatic, which is great. I'm going to go ahead and listen to your heart and lungs. I would normally listen over the shirt for this video. I'm just going to listen over. Deep breath. Great. Deep breath. Great. Your lungs are cleared auscultation bilaterally. I would normally listen to the posterior lungs, but for the sake of this video, I'll just do the front. I'm going to listen to your heart. Great. S1 and S2 noted. Regular rhythm. No rubs or murmurs heard. I'm going to feel your pulses. 2+ bilaterally. No signs of clubbing or edema or cyanosis. I see edema. So I'm going to have you follow my finger. good smooth movement. Checking for accommodation. Great. So go ahead and touch your nose to my finger. Great. So I'm going to look in your ears. Oops. Okay. Alright, so your tympanic membrane is pale gray. Your canals are patent bilaterally, no cerumen noted. I'm going to look at your mucous membranes. So can you say ah?
Ah.
Okay. Clear pink. I'm going to look at your eyes. Alright, your pupils are equal and reactive to light around about 3 millimeters bilaterally. I'm going to look at your optic disc. Great, no abnormalities noted. So now, can you smile for me? So great, you have facial symmetry and your eyes are symmetrical. I'm going to have you do a couple walking tests for me. If you could stand and put your feet one in front of the other. Great. And then stand and hold, close your eyes and extend your arms. Great. No abnormalities noted. So I'm going to have you sit back down. And I want you to tell me when you stop hearing this.
Now.
Do you still hear it?
Yes. Now.
Do you still hear it?
Yes.
Great. So now we're going to have you lay back. But for the sake of this video, we'll have you turn this way. Okay, and so then we're going to turn your head this way. No nystagmus, and have you sit up. No nystagmus. Do you have any symptoms of vertigo?
Yes.
Yes, okay. Oh no. Let's do it again real quick. Okay, well, it was video's positioned wrong, so I'm gonna relay back and turn your head. Okay, no nystagmus, and sit up. Alright, no nystagmus, any feelings of vertigo?
Yes.
Okay. Okay, so my 3 differential diagnoses for this is benign proximal positional vertigo, because the patient presents with vertigo that occurs with position changes. Also, Meniere's disease, because the patient presents with vertigo, associated nausea and ear discomfort. And labyrinthitis, because the patient presents with vertigo, she was sick last week and possibly had otitis media.